Let's take a look at the basic components of the response loop that are involved in the control of blood pressure as it relates to cardiac output and the heart. So the beginning of any response loop, we have to have receptors, and those receptors are located here. These are baroreceptors located in the carotid sinus and also in the aortic arch. Now, this information is going to be then sent via an afferent signal to the control center. So the afferent signals here and here are sent to the control center, which in this case is the cardiovascular control center in the medulla oblongata. There are going to be other components of these response loops. We are just concentrating right now on those involved with the heart. So the efferent signals now are going to involve the autonomic nervous system, and this can be either the sympathetic nervous system. So there's an efferent signal right there via the sympathetic nervous system. Here's another one going to the heart, the sympathetic nervous system, or we could also have the parasympathetic nervous system involved. So in summary again, we have the receptors, the afferent pathway, the control center, and the efferent pathway. At the end, the efferent pathway is going to be sending signals to the effectors. So let's just take a look here and see what the effectors are. We're going to have a variety of effectors. We're going to have, here we have the autorhythmic cells. So these are the cells that are going to be controlling the heart rate. And we also have the myocardial contractile cells, which are going to be controlling the stroke volume. Remembering that heart rate times stroke volume controls cardiac output, and as we're going to see, cardiac output ultimately is involved in the control and regulation of blood pressure. Let's take a closer look at what some of these responses are going to be. Looking at the autorhythmic cells to begin with. So these autorhythmic cells, if you recall, these are the pacemaker cells, and we looked at their action potentials. We said that they undergo spontaneous depolarizations and then generate action potentials. And they will continue to do so, that these receptors, these cells do not have a resting membrane potential. They have what's known as the pacemaker potential. If we want to increase the firing rate of these, all we have to do is increase the rate of depolarization. It will bring it to threshold quicker, and you will get an increase in the firing rate. As a result of an increased firing rate, you will increase heart rate. As a result, you will increase cardiac output. So, in response to a decrease in blood pressure, what you want to do is you want to increase heart rate, because that will increase cardiac output, and if you increase cardiac output, it will in turn increase blood pressure. Let's take a look now at the other effector, which are the myocardial contractile cells. These are the cardiac muscle cells, which are going to contract and cause systole in the atria and the ventricle. So the myocardial contractile cells, if they contract more forcefully, what they're going to do is increase the amount of blood that's pumped out per beat. Remembering that stroke volume is the volume of blood in milliliters or liters per beat. So if we increase stroke volume right here, what we're going to do is increase cardiac output. If we increase cardiac output, we increase blood pressure. And remembering that this overall scheme is a response to a decrease in blood pressure, so the response we're looking for is an increase in blood pressure. So the myocardial contractile cells are playing a role by increasing the stroke volume. In summary, in order to increase blood pressure, we want to increase the cardiac output. We can do this by increasing heart rate and or increasing stroke volume. We can increase heart rate by affecting the autorhythmic cells, and we can increase stroke volume by affecting the myocardial contractile cells. So these are the effectors and the response. Let's return once again to the efferent signal, which is the autonomic nervous system sending signals from the cardiovascular control center. So looking at here, we have sympathetic input coming to the myocardial contractile cells. We have sympathetic input coming to the autorhythmic cells. And we can see here that this is an increase in the sympathetic. This is an increase in the sympathetic. So let's just concentrate on that for a minute. Going back, let's return to the efferent signals from the cardiovascular control center in the medulla. Looking at the sympathetic nervous system, you can see here that there is going to be an increase in the sympathetic output from the cardiovascular control center going to the myocardial contractile cells. Here there's also an increase in the sympathetic output going to the autorhythmic cells. As it makes sense, the sympathetic nervous system, the fight or flight response, is going to result in an increased heart rate, increased stroke volume, increased cardiac output, and overall an increase in blood pressure. What I want you to pay attention to here are the type of receptors that are responding to norepinephrine being released from the sympathetic nervous system. You can see here the myocardial contractile cells. They are going to have adrenergic receptors, and in particular, these are beta-1 receptors. The autorhythmic cells are also going to have adrenergic receptors, and they are also beta-1 receptors. Now let's look at what's going on with the parasympathetic nervous system. You can see here that the vagus nerve carrying the efferent signal to the autorhythmic cells, right here, there is actually a decrease in the parasympathetic stimulation. So, antagonistic control, what you're going to do is you're going to increase sympathetic and decrease parasympathetic. The autorhythmic cells are then going to respond by increasing the heart rate. Again, pay attention to the type of receptor that is involved in this response. The parasympathetic nervous system is going to release acetylcholine, and acetylcholine is binding to cholinergic muscarinic receptors. Now, in this case, the response is actually being decreased. There's less acetylcholine being released. However, should the reverse occur and you would like to actually decrease blood pressure instead of increasing it, you would have an increase in acetylcholine from the parasympathetic nervous system, increasing the response of these muscarinic receptors on the autorhythmic cells. Now what I want to concentrate on is this relationship right here. Frank Starling's law, Starling's law of the heart. And what we have to just review here is that if we increase stretching of these cardiac myocardial cells, if we increase the stretch, what we're going to do is increase the force of contraction. If we increase the force of contraction, we are going to increase the stroke volume. So the question now is, how is it that we're going to increase the stretch of these cells? In the next slide, we'll take a look at Starling's law of the heart and look at the relationship between the end diastolic volume, as indicated right here. An increase in the end diastolic volume increases the stroke volume. What I'd like to do now is just concentrate on this concept of the end diastolic volume. We can see the relationship that if we increase end diastolic volume, we're going to increase stroke volume. So let's for a minute just review the cardiac cycle and take a look at where the end diastolic volume is. We can see here that the end diastolic volume represents the maximum amount of blood in the ventricle during a cardiac cycle, whereas the systolic volume, the end systolic volume, represents the minimum. The difference between the maximum and the minimum, you can see here, is the actual stroke volume. Look where this is going to be measured. This is end diastolic volume, at the end of diastole. So this is the end of relaxation just before contraction of the ventricle. So here we have isovolumetric contraction. This is where both the AV valves and the semilunar valves are closed, so that's going to represent the maximum amount of blood that's going to be in the heart during that cardiac cycle. Now let's look at the relationship between the end diastolic volume and what's known as the venous return, and I also want to discuss this concept of preload. So preload is the amount of ventricular filling before contraction, or in other words, at the end of diastole. So the amount of ventricular filling is going to depend on how much blood gets returned to the heart, and that is the venous return. So if we increase venous return, we are increasing the amount of blood returning to the heart during one cardiac cycle. So if we increase the venous return, what we're going to do is increase the preload. Remembering, the preload is the amount of ventricular filling before contraction, And if we increase that, we are then going to increase the end diastolic volume. Let's go through the logic one more time. If we increase venous return, we're increasing the amount of blood that's returning to the heart. That will increase the preload because we are going to increase the amount of ventricular filling that occurs before contraction, which is an increase in the end diastolic volume. And according to Starling's law of the heart, that increases the stroke volume. Okay, the Starling's law is indicated by the graph above here, that if you increase preload, you're going to increase stroke volume right here. Okay, you can see that the sympathetic nervous system has an effect on this. We will look at that in a little bit later, but right now, following the logic that if you increase preload, you increase stroke volume, which then increases cardiac output and as a result increases blood pressure. The final component of the response loop that I want to look at in this presentation is the sympathetic nervous system affecting the veins. Okay, this is the venous system here. This is blood returning to the heart, deoxygenated blood returning to the heart. And note that sympathetic stimulation of the veins causes them to constrict. What this is going to do is push more blood back to the heart, increasing venous return, increasing the preload, and as the previous logic dictates, this will increase the end diastolic volume, stretch the heart more, and it's going to increase stroke volume and increase cardiac output, and again, increase blood pressure. So the sympathetic nervous system is affecting stroke volume in two different ways, directly by the norepinephrine binding to beta-1 adrenergic receptors on the myocardial contractile cells, as indicated right here, and then also by indirectly increasing venous return, increasing end diastolic volume, and increasing stroke volume.